Hello everybody that might be tuning in. My name is Ryan Hickey. I'm a career firefighter paramedic, and today I'd like to spotlight an issue in male health that should be of grave concern to every man out there, anyone that's ever loved a man, and especially my brothers in the fire service, being that we're in a career field that is 95% male and is already extremely predisposed to many types of cancer. And one that affects us the most is prostate cancer, the second most common type of cancer amongst men, right behind skin cancer. Every year, 288,000 men are diagnosed with prostate cancer, and 34,000 annually will lose their battle with it. However, with early detection, there's an extremely high survival rate of nearly 100%, emphasizing the importance of screening and early detection. Okay, let's pose the question of what is prostate cancer? And to do this, we can take a look at the male anatomy, and with a not so to scale and not so invasive view using our volunteer here, you can see such. Prostate is a walnut-sized gland located just below the bladder, just forward of the rectum. It plays a very important role in the male reproductive system, and prostate cancer is going to present as a malignant growth on this gland. Okay, so that's a look inside, but what about outside? Any signs or symptoms that we can be looking for prostate cancer? And the unfortunate answer to that is no, there's not. Prostate cancer is what's known as a silent disease. Typically, by the time symptoms such as painful urination, pelvic pain, blood in the semen start presenting, the disease has already progressed to a point where there's no longer an optimal health outcome. So we have to take a look at some risk factors. Men over the age of 50, and then that risk only increases with age. African Americans are twice as likely to receive a prostate cancer diagnosis, as well as twice as likely to die from prostate cancer. Those with a family history of prostate cancer, namely if you have a father or a brother, you're especially predisposed to being diagnosed with prostate cancer, as well as anyone in a profession where they're going to inherently be exposed to dangerous toxins, chemicals on the job site, namely firefighters, police officers, those who work in industrial sites, including construction. And namely, the most important thing is going to be awareness and ensuring that you're being screened regularly. All right, it's time to talk screening. And the bottom line with prostate cancer, early detection saves lives. I get it. Uncomfortable subject. A lot of guys are going to feel fear or embarrassment when approaching it. But it's very important that we take a step back and remember that being proactive and not reactive is not only a sign of strength and smarts, but it literally could be the difference between life or death. If you're over the age of 50 or 45 and even younger, if you're in a high-risk group, please at your next physical discuss it with your primary care provider. There's blood tests available in addition to the typical digital. All right, to all the men out there, just going to state the obvious. Your health matters. If you haven't had the conversation with your doctor yet, now's the time. Or if you know someone over the age of 50, check up on them. Sometimes a little bit of support goes a long way and will make all the difference. A lot of us pride ourselves off of protecting others, but we need to remember to protect ourselves. You can't protect your crew, your family, your community unless you're first protecting yourself. If you're 45 or older, speak up, get screened, and encourage others to do the same. You set the example. Just remember, stay strong, stay healthy. You've got people counting on you. Thank you.